Good afternoon. My comments are complementary to Dr. Halberg's, in fact, around education and environment and community linkages. I will place them in a little bit more of an evidence framework, but focus on two, and if you hear three, that may be true as well. I would like to reiterate, though, that the approaches that are implemented at the work site need to be considered in the context of other things that are going on in people's lives. So, in other words, approaches actionable at the work site need to complement other obesity solutions happening outside the workplace as well. The first actionable opportunity at the workplace, from my perspective, is to actually counteract the sedentary nature of work. Over the past 50 years or so, an increasingly and significant change or shift has happened in the fact that work across our society has become more and more sedentary. Based on a review of the Foresight obesity causal maps by Vandenbroek and others in the UK, we actually know that overall physical activity levels are causally related to sedentary nature of work. In effect, prolonged sitting time has become a significant risk factor for increased weight. An example is a solution designed to break up prolonged sitting time by installing sit-stand devices for employees with sedentary job types. This intervention is not designed to result in weight loss per se, but does result in better mood states, increased energy expenditure, less upper back and neck pain due to static tension in front of a computer, overall workplace productivity, as well as increased overall movement and mobility that may aid in the prevention of weight gain. The Health Partners Take a Stand project was actually a study that showed the feasibility as well as the effectiveness of this program. The program changes the physical work environment of the worker and involves the management team and also changes the psychosocial work environment as a result. Counteracting prolonged sedentary behavior at work that does not disrupt the workflow and is a good experience for the worker may have a significant impact on energy balance and generate other beneficial health and well-being outcomes. Second actionable opportunity I'd like to highlight is to really, through the workplace, increase access and consumption of fruits and vegetables. We looked at a review of over 500,000 employee health assessment results and observed that only 17.5% of employees actually consume 5 or more fruits and vegetables per day. We tested an organizational policy intervention looking at reducing the price of salad bar purchases in a corporate cafeteria. We reduced the price of salad bar purchases by 50% during the month of March in 2012 and analyzed sales by month for February through June of that year. Salad bar sales by weight more than tripled during the price reduction period and returned to baseline immediately afterward. Employees indicated that the high price of salads relative to other choices is a barrier, significant barrier to purchase. Policies that make the price of salads equal to other choices in corporate cafeteria settings may significantly increase healthful food consumption. This environmental policy intervention is shaped using the policy framework as a change method. And finding ways to increase consumption of fruits and vegetable intake for employees while at work may be a significant opportunity to improve overall nutrition and impact positively on weight-related outcomes. An important contextual situation at the workplace is to connect the workplace itself to the larger community. Connecting workplace efforts to larger community efforts actually supports sustainability of the effort as well. For example, supporting employees in finding better for you food options, for example, through timely text messages sent immediately prior to lunch, as a reminder to select healthy food options, and is a simple tactic. An app that provides easy access wherever you are in the country to find healthier for you options from menus in the community through restaurants that are accessible for these kinds of options. But to get these things to happen, there needs to be a business case that's developed for business, for employers, to actually generate a decision-making framework that can support allocation of resources in this area. There is lots of work going on in this area. In fact, the Institute of Medicine is currently supporting an effort by the Health Enhancement Research Organization to look at the connection, the linkage, if you will, between employers and communities. And those kinds of efforts, inventorying them, identifying them, describing them, and tying them to a business case will be an important effort going forward. Connecting worksite-based initiatives to community activities can extend the reach of these efforts related to physical activity, to nutrition, obesity interventions beyond the workplace, increase scalability as well as sustainability of efforts to improve health and address excess weight. Finally, addressing very quickly the notion of health equity and the role that employers may play in this. Employers are notorious to have good data on many issues. In fact, in the areas of health, there is lots of data available in an employer setting. Data is needed to identify population segments that are, in fact, have disparities. Data on reach and engagement is needed to monitor progress for all to attain full health potential. So an approach that looks at health equity using data through an employer lens seems to have lots of promise. Thank you.
I think these are really exciting developments and examples of what can be done in worksite promotion and can really serve as national models. I think that because we're running a little behind, that we're just going to hold the questions and comment period, and then you'll be around during the break. So I think we'll just move into the session on healthcare, but I'd like to thank our panel members.